increased activities in a different way. How I'm the average clinician, I'm in my clinic, I'm reading my journals. How can I take these clinical findings and make them relevant to what I'm seeing every day or my patient population? What can I do?
Yeah, that's always the important part. A lot of people say it takes about 8 to 10 years for information from the scientific community to make its way into clinical practice, and we don't have that kind of time. We really want clinicians to have a sense of what this means and what its applications are for them. So I think there's a few. The first and probably the most important is that kids in general, healthy kids in general, don't move well, and that probably is a significant contributing factor to injury. So when clinicians like athletic trainers and physical therapists ultimately end up with these children as their patients, they probably are well served to have that understanding that they didn't move well to begin with. And a lot of the rehab process or the return to sport process is giving them the fundamental building blocks of being able to participate in sport. It's the clinicians have a much broader responsibility than just rehabbing from that injury. They almost have to peel the layers of the onion even further and get back to, what did this individual move like, or what was their status pre-injury, and kind of work forward from there. So I think the one of the most important takeaways for clinicians is to have that fundamental understanding that, according to these findings anyway, most kids' movement quality is poor.
Yes.
And just rehabbing the injured side or the body part isn't enough. It's part of it, but we have to keep going further and kind of get kids to the point where they move well in order